acute fulminant hepatitis that's destroying your liver beyond your capacity to regenerate it, or it could be a much more insidious chronic damage resulting in significant cirrhosis that then you're going to see those changes. That works, Zaya? Yeah? So imagine a question now based on that. Now that we reviewed all this, let's take a 48-year-old male. That 48-year-old male has increased abdominal girth and also has icterus, scleroicterus, which you remember is most sensitive, and skin jaundice. Now, in the lab findings, let me see, includes total bilirubin, 5.5 milligram per deciliter, of which direct is 4.5. So you know, I'm going to tell you that alkaline phosphatase is at 90 units per liter. I'm going to tell you that AST, ALT, let's see, this one is at 350 units per liter. ALT is at about 185. I'm going to tell you that my albumin in the serum is 2.5, that's grams per liter. And I'm going to tell you my prothrombin time is 18 seconds. I will remind you here that the control in that test was 12 seconds. And I'll even give you a blood ammonia. (10 to 35 micromolar). Now, based on this, what is most likely in the patient? And I'll give you 5 nice choices to play with. So let's see. And let's see. There we go. So your 5 choices on this one I'm expecting that patient to have IgM anti-hepatitis A virus, a macrovesicular steatosis and micronodular cirrhosis, a severe hypercholesterolemia, some anti-pyruvate dehydrogenase antibodies, or a history of ulcerative colitis and positive anchors. You know your normal values, huh? Doing good. Already 9 answers, but we can put more in there. So what is the first thing you would look at in the labs here? Because you have someone with jaundice. So what is the first important thing to check in your mind? The bilirubin. Absolutely. Yes. So number one, we're going to look at this. And what we need to know is it going to be a conjugated or a non-conjugated bilirubinemia, right? First, I know that both are elevated because normal, well, it would have been about 0.1 to 1.2, of which about half is going to be direct. So here I have a conjugated bilirubinemia. Now that I know it's a conjugated bilirubinemia, then I need to figure out, is it because of the liver or is it because of the biliary tract? So is it cholestatic as a jaundice or is it hepatic as a jaundice? So number 2, I'm going to answer, is it cholestatic or not? So tell me, alkaline phosphatase at 90. Is it normal? Is it elevated? Ala, you were about to say something, no? You know, normal, absolutely. Yeah? This one is normal because anything between 40 and about 130 is okay. So because alkaline phosphatase is normal, what is it I can say that jaundice is not? That's right, Matangi. It's not